Good evening, everyone. Wynn Brown here on Thursday, April 2nd with Haywood Healthcare's evening update on COVID-19. I'll start with the numbers. To date, we have tested 584 inpatients and outpatients with 353 negative results or no virus detected, 57 positive results so far in our community. On the inpatient setting, we have 5 patients that have tested positive for COVID-19 and 6 rule-out patients. As I've told you before, meaning we're waiting for their test results to come back. Just a shout out to John Nowak, our Director of Food Services. He's been helping out on the PPE side. As you know, that's personal protective equipment. We were having trouble sourcing through our regular sources, the Bouffant hairnets that we usually use on the inpatient setting, and he was able to do it through his food service sources. So thank you very much for that, John. Awesome job. I love the cross-departmental work. I also today was interviewed by Bonnie Benjamin on AOTV, Public Access Television. A link to that is embedded with this report going out to you today. And I just want to thank Bonnie for her great interviewing. Second time I've interviewed with her, and she does a great job, and she's a great community leader amongst us. So thank you to AOTV and Bonnie for that. Just a note to everybody, while you're punching in and you're punching out, please keep your social distancing skills. We've been queuing up a little bit tight by the time clocks, and that makes a few people uncomfortable, or a lot of people uncomfortable. So please just pay attention to that. I know people are trying to slip in get punched in within the interval that they need to, but I think we'll give you a couple extra minutes if it's going to take that much time. So just please make sure of that. Just a shout out to our ICU nurses, who are our crusaders on this fight, taking care of our most critical patients. They have such great attitude and resiliency, and I just want to thank them for that. They also have written messages for patients' families that they hold up to the windows and flash flashlights so that patients know, family members outside know that we're taking good care of them. And because right now it's very difficult because family members cannot visit their loved ones in the hospital. And so we appreciate what our nurses are doing to let the families know that we are thinking of them and taking great care of their family members. So a great shout out to them. Also, just some thank yous. We've had a lot of thank yous going out in the past few days. We had a group come together that gave us a Gardner Ale House gift card to buy food, special treats for our staff. And Rick at the Ale House decided to match that and double that. So we'll be using that shortly for our staff. And I want to thank Cushing Academy. As you know, Cushing Academy isn't in session right now. And they lent Jamie Ledger on our team their two printers, so 3D printers. And so, as I mentioned earlier, we've been testing out the face shields that have been used, made with those printers. And we have a plan, Jamie, to produce about 150 of the face shields. And so thank you very much for that. If you're interested in doing that for us as well, you can go on our website, and the instructions are right there at haywood.org. And also just thank you for all the videos that have been sent to thankyou@haywood.org, which we have been emailing regularly to our staff to let them know that the community is supporting them and appreciates them. And so keep those coming. Those little gifts are a great way for people who can do something from the comfort of their own home. It can be just a quick little thank you, or it could be some little skit, whatever it might be. We appreciate your creativity and thanking everyone. Tomorrow is Jeans for Greens Day. So once a month we have Jeans Day. It's $5. This month it'll be going to our Caring for Colleagues fund, which supports staff who need financial support. And obviously this is one of those times of crisis that we're experiencing, and it's being used regularly now. So I encourage everybody to wear their jeans tomorrow if they are in a non-clinical setting that allows them to happen. And just a shout out to Teresa Thompson, Mary Gianetti, and Jennifer Sibley, and our community partners and volunteers. Today we stocked the Winchendon CAC with 10,000 pounds of food. It has never had that much food in stock before. Just some of the work that we do to make sure that we address food insecurity in our community, and I appreciate the work we're doing. That's in addition to what I mentioned earlier today, that we were distributing 630 weekend backpacks food to kids across our region. And it's National Organ Donor Month, and you can go online to their website to see how you can participate and support National Organ Donor Month. My father had a heart transplant when I was a senior in college, and that heart gave him 25 more years of life. So I encourage everybody to if you have time while you're at home, to log on and participate in that important organization and the work that they do. So that's all the news that I have for you tonight. I appreciate those who are at the hospitals tonight working and taking care of our patients. And for those of you at home, please get some rest, and I'll be back with you tomorrow as we continue our journey to be one of the best community-owned health systems in America. Take care.